A sports physical is an opportunity for the pediatrician to evaluate any risks for a patient in participation in sports, as well as doing a comprehensive physical exam to check for any risks that may be posed to them, any signs of chronic illness that need to be addressed. We typically start sports physicals around 11 years old. It can be sooner depending on the sport, and then continue up through high school while they're doing sports and potentially into college. It's important to do a sports physical so that any conditions or concerns can be evaluated prior to the start, and we're optimizing our kids to be healthy during sport participation. Sports physicals are required at least every 2 years in Wisconsin. That can vary by state, but the goal is that once kids are getting into more strenuous sports throughout their careers in school, that they're healthy and ready to go. The provider will go over past medical history, including any chronic conditions currently being treated. They'll go over any past musculoskeletal injuries, family history that could potentially put them at a life-threatening risk. For example, cardiac issues that may be undiagnosed in the family. We like to encourage doing the sports physical with the yearly wellness exam so that we're not just looking at past medical history and the physical, we're also looking at their mental health, their dietary habits, which can also be areas of concern for our kids. So if anything is found that's concerning during the sports physical, we ask for evaluations prior to fully clearing or potentially having some restrictions on sports play. We encourage kids to do these at least 6 weeks before the sports season starts so that they're getting those in on time and can be evaluated if necessary. Some of the things we typically catch are poorly controlled asthma that are going to hinder their ability to do strenuous exercise and run around like they might need to in basketball, for example. So we like to get that optimized prior to the start of the season. Things we're looking for in exam are musculoskeletal injuries, scoliosis, where there's a curvature in the spine, can cause problems down the line. And so if we're seeing things like that, we want orthopedic doctor to see them prior to the start of the season. If there's hypertension, we also want that controlled prior to the start of the season. So we're looking for a lot of different areas of the body. Our goal as a pediatrician is to make sure that our kids are healthy and able to fully participate in the sports that they enjoy. And we just want to make sure that they're safe out there doing what they love.